Good morning. Welcome you all to our course Radiation Oncology Physics, and today we are going to discuss the kilovoltage units. These kilovoltage units are used for external beam radiotherapy in radiation oncology as a, or you can call it as a teletherapy unit, and this lecture is lecture number 13. Learning objective of today's class will be the Grange ray therapy, the contact therapy, the superficial therapy, the orthovoltage therapy, and the super voltage therapy. Here it is actually wrongly written as cobalt 60. It is already discussed in last classes, and so this is super voltage therapy. Super voltage therapy. This is today we will discuss the Grange ray therapy, contact therapy, superficial therapy, and orthovoltage therapy and super voltage therapy. All these we will discuss one by one, and these equipments are used for radiation oncology. They are under kilovoltage units. For a quick recap, it is already discussed in last classes, but still I would like to give you one quick recap of X radiation production. And we know that charged particles are interact with positively charged nucleus. Charged particles are electrons here, and these are the electron slows down because of these nucleus interactions, nuclear field, electrical field interactions, and because of this slow down process, this is breaking of radiations, and we get the Bremsstrahlung radiation as X-ray. These are actually Bremsstrahlung radiation. These are Bremsstrahlung radiations. And in X-ray productions, we know there is a tube which is highly vacuum is created here, and one filament that is acted as a cathode, and one anode that is positively charged is kept inside this X-ray tube, and the low energy electron beams are ejected from the filament because of thermoionic emissions, and they travel towards the anode directions because anode is positively charged, and they strike the target. This target is high Z material made up of tungsten or other high Z materials, and because of the Bremsstrahlung phenomenon, we get the X radiation beam from the cathode from the anode side. And we know that X radiation during this interaction, the electron may give the whole energy, or they may give the whole energy, or they may not give any energy. So there may be loss of zero energy, or there may be loss of maximum energy of the whole energy of the electron. So it is a continuous spectrum, and so we describe or specify the X radiation by kilovoltage, or more specifically the kilovoltage kVp, or kilovoltage of the peak potential. Now kilovoltage units, they are prominent units for external beam radiotherapy up to 1950s. They are used for treatment of cancer patients as a external beam radiotherapy, and the radiation type is of course X radiations, and the energy range is less than or equal to 1000 kilovoltage. Their depth of penetration, because they are low energy X radiation, the depth of penetrations are very low, and their popularity of these use of kilovoltage units decrease because of the invention of cobalt 60 and high energy units afterwards of 1950s. And still in present era, because of some salient features like their sharp dose follow-up and their ability to treat the superficial target or tumors, they are still useful, and these units are still used in some clinics for treatment of specific cases of malignancies. Now kilovoltage units, they are subcategorized by the National Council of Radiation Protection based on their beam quality. Now what is beam quality? Beam quality is the radiation quality where which describe the energy, the half value layer and their scattering and their absorptions. All these parameters are considered to define the beam quality. Their usability, where these kilovoltage units are used, and these are also a parameter which used for to subcategorize the kilovoltage unit. And the depth of penetration, this is a very important parameter of any kilovoltage units or any therapeutic range, their therapeutic depth. So according to these three parameter, the National Council of Radiation Protection divided the kilovoltage units in 5 categories. So in 5 categories, the kilovoltage unit, the first one is Grange ray therapy, the second one is contact therapy, third one is superficial therapy, and fourth one is orthovoltage therapy, and fifth one is super voltage therapy. Their name were also defined as per their use, because contact therapy is only used for only superficial, means very low depth target, and orthovoltage therapy, they are known as also deep therapy, and super voltage therapy, they are higher voltage therapy are used for kilovoltage unit subcategory. Now first one is Grange ray therapy. Grange ray therapy, where the very soft X radiations are produced, and these operated under less than 20 kilovoltage, and these Grange ray therapy has very low depth of penetrations, some 0.1 or 2 millimeter depth of penetration, and because of their very low depth of penetrations, they are no longer used in radiation therapy. So this is a unit of Grange ray therapy which is earlier used, but nowadays these equipment are not used for treatment of cancer patients. Now contact therapy, this is very very useful therapeutic kilovoltage unit which is used for various purpose of various skin tumors and various other superficial tumors which has 1 to 2 millimeter of depth, and these contact therapy are also still used in certain clinics, and these contact therapy, they are operated between the potential of 40 to 50 kilovoltage. So operating potential is 40 to 50 kilovoltage, and the tube current are approximately they are operating under 2 milliampere, and their source to surface distance, this is a very also one of the prominent parameter to define any type of radiotherapy unit, that is source to surface distance, means source to surface distance is 2 centimeter or less in contact therapy, means your source is placed 2 centimeter away from the surface or from the surface of the patient's or any therapeutic surface. There are some special applicators are also used to direct the beam. These applicators are touched the patient skin surface, and here we use filtration. Filtration means there are some filters we used in front of X radiations. What are the purpose of these filters? These filters reduce the soft component, they absorb the low energy X-ray. If you see the earlier graph, if you see, these are the area which are very low energy photons, they are absorbed by the filter, and finally the beam which come out from the filter, they are high energy, so their penetration will be higher. So this is known as the reduction of the soft component, or you can call it as beam hardening process. So in filtration, here in contact therapy, we use 0.5 to 1 millimeter thickness of aluminum. and the therapeutic depth of this contact therapy is 1 to 2 millimeter of the patient body or from the patient surface. So by the contact therapy, we can very effectively treat the skin lesion and where the maximum dose is delivered, while there is a very sharp dose follow-up underlying the tissues of the skin. They will get the minimal dose, which is the utmost requirement of radiation oncology. Now coming to the superficial therapy, if you see the name of superficial therapy, so this equipment also used to treat the superficial lesion or superficial targets. Here this superficial therapy operated between the potential of 50 to 150 kilovoltage with a tube current of 5 to 8 milliampere. This is the operating potential. So this is the operating potential and this is the tube current. Here again the source to surface distance is higher than the contact therapy. Here the source to surface distance or SSD, you can call it as SSD, is 15 to 20 centimeter. Now in superficial therapy, we use the filtration of 1 to 6 millimeter thick aluminum, which purpose again to reduce the soft component and beam hardening of the beam and to achieve the HVL of the beam quality or beam quality of HVL half value layer. You know this is half value layer 1 to 8 millimeter of aluminum. Here the therapeutic depth is 5 millimeter. These superficial lesions are able to treat up to 5 millimeter depth of the target. So this is also this superficial therapy also used for treatment of superficial lesions such as just some skin lesions, some basal cell carcinoma and any nodes which are situated up to 5 millimeter depth from the skin surface. And because of this sharp dose follow-up of the superficial therapy, we can treat the superficial lesion without giving the much higher dose to the underlying normal tissues, which is the utmost requirement of the radiation oncology. So this superficial therapy, it is potential, operating potential 50 to 150 kV. This is higher than contact therapy, and the tube current is 5 to 8 milliampere. So these are the important parameters. These are actually the important parameter which are differentiate from other therapeutic unit of the kilovoltage units. And filtration, again this is filtration 1 to 6 millimeter thick aluminum, and which able to achieve the beam quality with HVL of 1 to 8 millimeter of aluminum, and here the therapeutic depth is 5 millimeter. Now orthovoltage therapy, this is a type of kilovoltage therapy which is known as deep therapy, because this is the unit which used to treat the more deeper lesions than the contact therapy or superficial therapy. So they are known as deep therapy or orthovoltage unit. The operating potential here is 150 to 500 kilovoltage, but there was problem of the X-ray transformer to create the higher potential, to provide the higher potential up to 500 kV. So these deep therapy orthovoltage units are preferably operated under the 200 to 300 kilovoltage potential, and the tube current is higher than the contact therapy and superficial therapy. Here the tube current is 10 to 20 milliampere, and the source to surface distance is 50 centimeter. Means we can place the patients 50 centimeter from the source. We will discuss in later classes the how this source increase of source to surface distance is helpful to achieving the good or better penetration or better depth dose distribution. But in previous three type of therapy, we do not use any type of collimation system. But here we require the proper collimation system, collimator, proper collimations for beam definitions, means to define the field size, the amount of area or amount of volume we are going to treat. This is defined by the proper collimators which is attached to the to the output of the X-ray beams. So because of this collimator we can define the field size. We can define various field size of type of field size and various size of field size, and again here we use the filtrations. Here we use varying thickness as per our requirement of the special type of cases, the depth of penetration we want, and we use the varying thickness of aluminium. Certainly they are higher than the thickness was higher than the contact therapy and superficial therapy. They reduce the soft component and they harden the beam to achieve the 1 to 4 millimeter of copper. Still in the last 2 or 3 type of filtration we use the HBl of aluminium. Here we use the HBl of 1 to 4 millimeter of copper. So we use varying thickness of filtration to achieve the beam quality of with HBl of 1 to 4 millimeter of copper. So according to our requirement we can change the filtration and we achieve the HBl ranging from 1 to 4 millimeter of copper. And the therapeutic depth we achieve in the orthovoltage therapy is 2 centimeter. So deep therapy is used for in the orthovoltage range to 200 to 300 kV. Still their potential range is 150 to 500 kV. Because of some that time there are problem to providing the higher voltage, so they limit the orthovoltage therapy to 200 to 300 kV, and tube current is 10 to 20 milliampere. SSD is 50 centimeter. You just need to remember all these points because these are important for definition of kilovoltage units. Now super voltage therapy, and because the post-war development there was a desire to design high energy units, because our requirement was to treat the deep seated tumors or deep seated target by the external beam radiotherapy, and these super voltage therapy their potentials are used from 500 to 1000 kilovoltage. Again we have already discussed that there was a problem in high voltage transformer if we use the conventional transformer. So achieving potential more than 300 kilovoltage is not possible at that time. So they are design some different kind of transformer or different kind of arrangement so that we can achieve the 500 to 1000 kilovoltage of potential to treat the deep seated tumors, because the tumors are not only situated only superficial lesions, they may be deep seated. So there was a need to design high energy or high energy X-ray beam units. So there is a consistent development so that these voltage, higher voltage can be achievable. So there is a design we will discuss in the next slide. In super voltage therapy they have used a specific design that is known as resonant transfer unit. that is known as resonant transfer unit, where they use to produce 300 kilovoltage to 2000 kilovoltage. These resonant transfer units are used to 300 to 2000 kilovoltage, means they can achieve the potential up to 2000 kilovoltage. Now these high voltage transformer, actually they are connected in parallel. These high voltage, they are conventional transformer, they are connected in parallel with these capacitors, they which are lengthwise distributed inside the X-ray tube. So these are the capacitors, these are the capacitors, these are the capacitors, and they are conventional transformer. These are conventional transformer, these are conventional transformer, which are used, which are connected to the in parallel with series of capacitors. These series of capacitors are distributed lengthwise and they are inside the tube. Now the combination of transformer secondary and this is transformer secondary and this is transformer primary. This transformer secondary and the capacitor in parallel, they create the resonance. They create the resonance, and at resonant frequency, the oscillating potential attains high amplitudes, and thus we get a higher peak voltage, and this peak voltage become very large. So here if you see the design, there is, this is filament, and these are the capacitors which are arranged within the tube lengthwise, and these are the secondary of the conventional transformer, and this is the primary of the conventional transformer, and we have a input voltage. Now electrons are injected from the filament because of by the thermionic emission process, and this electron proceeds and they receive the higher voltage, and this they hit the target and they produce the X-ray beam. And so these X-ray beams are higher than the orthovoltage therapy, contact therapy, and all these conventional kilovoltage therapeutic units. Now this is a summary of all these type of therapeutic unit we have discussed, and this is actually the depth dose comparison of different kind of kilovoltage therapy, and we have already discussed the cobalt 60 gamma radiations. This is currently used in radiation oncology. So we will compare all these type of kilovoltage such as Grange ray therapy, contact therapy, superficial therapy, orthovoltage therapy with the cobalt 60 gamma radiation and cobalt 60 gamma radiations. Now if you see that this A red one, first we will describe the curve. Now we mention the percentage depth dose along this side, along Y side, and we will mention the depth in water along the X directions. So this is the 0 depth and this is 0 0. This is 0 depth. So in 0 depth there is 100% dose. So there is 100% dose. Now A, this is for, this curve is defined for Grange ray therapy, and you can see that this curve is fall within few millimeter, and it is the, this is the depth dose, percentage depth dose is reduced at very few millimeter. Now B is the contact therapy, where you can see the 100% dose is reduced up to 2 to 3 centimeter, and this is the curve, this is blue one, this is the curve for contact therapy, and red one is curve for Grange ray therapy. Now superficial therapy, this is the C, and we define this curve as green color, this is green color. You can see their dose follow up is lesser than the A and B, means Grange ray and contact therapy, and D is the orthovoltage therapy. So this is the orthovoltage therapy, where it started from 0, and it dose follow up is lesser than the all these previous 3 kilovoltage units. Now if we compare the E, which is the curve of depth dose curve of cobalt 60 gamma radiations, you can see at superficial, at surface, it has a very it has a percentage depth dose lesser than the 100, and it increases up to 5 millimeter, it increases and reaches up to 100, and then this curve, the percentage depth dose fall as per we increase the depth of the water. So this is the cobalt 60, and because of this region, this is known as build up region, we can spare the skin, the normal skin, and we can treat the deep seated tumors by using high energy beams such as cobalt 60 radiation. So this is the difference between the kilovoltage units and the higher energy or mega voltage units. You can see all the kilovoltage units started from 100, they giving the 100% dose to the surface, and cobalt 60 gives the lesser dose than the kilovoltage unit in the surface. So this is the area of build up of cobalt 60. This is the this is the build up region, and this is approximately 0.5 centimeter for cobalt 60. And this build up region, if we go further, we will get lesser dose in surface, and this curve will be like, and we will get the higher build up regions. So we can spare the superficial structures while giving the higher dose to the deep seated tumors. And this is all for our today's class. Thank you.